I'm first going to introduce Kellyn. She's a chartered psychologist and research fellow on aging and dementia, and a co-director of the Doctoral Training Center for Dementia Care at the University of Southampton. Welcome her to the stage.
Thank you to Kim for inviting me, although I'm really disappointed to be here. And the reason I'm disappointed is because the work that I do needs to change. I don't want to be invited to these conferences because what I'm talking about are inadequate support for people living with dementia and inadequate support for care partners. Families not being supported. So if I'm not here, it's because that is being done. So that's why I'm disappointed I'm here, but I still feel privileged to be sharing this room. So my name is Dr. Kellyn. I'm a BPS Chartered Psychologist. What that means is British Psychological Psychologist. So the work that I've done, predominantly academic and practice, I submit to them, they give me chartership. I'm a business academic, so I was an academic for many years, got very frustrated with doing lots of research but not implementing any of it. So what I was doing was creating, and lots of us were creating really great knowledge, but we weren't seeing anything put into practice. We were just moving on to other projects, or we were, writing clever papers that other clever people would read, but actually some of them weren't even open access. So the people that really needed to read them couldn't access them. I'm the creator of Material Citizenship, which is a programme of dementia care, which I'm talking about tomorrow afternoon. And I'm also the founder of the Dementia Care Hub, which is a charity I started it in 2021 as a group of people living with dementia and their care partners, and then it became a charity in 2023. My vision is that everybody who is living with dementia, their families, their care partners, have somewhere to go. In the UK, we don't do particularly well, I don't believe. The lived experience of people living with dementia is still incredibly poor. I still have people coming to me who haven't seen anybody for 4 years. They have a diagnosis, they're left. They don't know where to go, they don't know who to speak to, they don't know what to do. Most people don't even understand the dementia that they have. They will still say to me, Kellyn, what's the difference between Alzheimer's and dementia? So really basic educational level, I do not understand the condition. I do not understand what's to come. So Dementia Community Hubs is a spin-off from the Dementia Care Hub. So I created a model. It started off just as a voluntary social group for people to get together. It was a grassroots charity. So I listen to what people are saying to me they need, and I try and find a solution. So it then built into wellbeing sessions for people living with dementia, a We Care dementia care programme, which is based on acceptance and commitment therapy, for care partners to adjust to the changes, not get too stuck on, but this is the way life has always been. I don't want to be flexible. So what I found with the charity was, unfortunately, with it being a small charity, we couldn't roll out. There's only one of me. So there were many, many people that couldn't access what we were doing. So I've turned it into the Dementia Community Hub, which a lot of it is online. So I want to see a Dementia Community Hub in every town, in every city, because that means that people have access to go somewhere. It places Dementia Community Hubs in care homes. Now, this is something I never saw coming. Most people don't want to move into a care home. That's the last thing that people want to do. But in the UK, we have 80% of people that live in care homes have a dementia of some kind. So it may well be part of that journey, even if we don't want it to happen. If we have dementia community hubs within care homes, what we are doing is we are getting people familiar with a space that they may move into. They may not, but they may. So all of the work that I do is about reducing avoidable distress. There may always be some level of distress with dementia, but if we can reduce avoidable distress, we're doing a good job. So this is to provide families and people living with dementia support from diagnosis right through to death. I don't believe anybody should walk this path alone, and I'll do everything I can to make sure that they don't. So this is the typical journey of a family living with dementia in the UK. So typically somebody will notice that there are some memory problems, but more than that, there's something significant that's changing. They'll go to their GP will refer them to a memory clinic. A memory clinic, their job is to assess, diagnose, titrate. What I mean by titrate is they look at the medication that's available, whether the person can tolerate that, whether they can take it if they've got other multimorbidities, and they will look to optimise that medication to the best it can be for that person, and then they discharge. Typically, I have people saying to me, well, when are they going to call me again to come in for a review? They're not. You've been discharged back into the community. Well, who's contacting me then? Nobody. You're the person that will have to go to your GP and say things are changing. So this whole idea that people are going to be looked after doesn't actually materialise. Families will tend to struggle. Care partners are at the highest risk of poor health outcomes than any other carer group. Carer stress, carer burden, anxiety, depression, high blood pressure. So families will struggle. After several years, they may come across a group, but that depends what area they're in, whether one exists. There's this idea that if you get a diagnosis, all these doors will open for you. Well, those doors may not be there. So what then happens is a crisis situation occurs. That's when every agency gets involved. You have adult services, you have medical services, everyone gets involved and everyone starts making decisions for you. So people can become really disempowered at this point because they're not making the decisions. Things are being done out of sense of urgency. So then people are questioning, should I have done it? Would I have done it? How could I have done things differently? And then typically a person may be put into a care home. Not move into one, but put into one, because it's the one that's available at that time and they meet the eligibility criteria for it. This is traumatic for everybody. I've worked psychologically with people and families who never get over that change, who never get over that person moving into a care home and the circumstances that led to that. So this is what I want. I want Dementia Community Hubs in every single care home because the buildings already exist. We don't have to create new buildings, they're already there, and many of them already have the spaces if they are willing to engage. So the same process would happen. There would be a GP appointment, a referral to the memory clinic, titration, optimisation, that would still take place. So imagine walking in there, you get a prescription, a medical prescription, but you also get a wellbeing prescription. So the wellbeing prescription is go to the Dementia Community Hub and you will be supported. So families will attend a Dementia Community Hub, they will attend social groups, they'll meet other people in a similar situation. But it's not just a group of which they're mixing with other people that are in a similar situation. There's a forward process. We will be looking at what benefits do you know you can receive? What help do you know you can receive? Have you got lasting power of attorney? Do you have attendance allowance? What's your support network? What do you think this path looks like? What type of dementia do you have? Do you want me to tell you what type of dementia that is? And do you want me to explain what that looks like for you? So they get accessible advice, information, support, signposting to different services. The emotional support is called the We Care Dementia Care Programme, acceptance and commitment therapy, and ongoing care planning. So we see you every week. Rather than a group that's every third Thursday of the month, which I can never remember when those groups are, it's every week, because if I miss one week, you're still there the next. I don't have to worry about not attending because you're always going to be there. We can look at care planning. So when people come in and we lay eyes on somebody, it can be the case that they're not looking okay today. Typically, everyone that walks in and I'll say to them, how are you doing? Yeah, I'm fine. Well, you're not fine because you're here. Okay, so let's look at how you're not fine. I'm noticing that you aren't looking good today, so I'm going to make a mental note and I'm going to come over and chat with you in a minute. So that's what the social groups do. We also run wellbeing sessions. Wellbeing sessions are for people living with dementia. The reason we ran these is because care partners were saying to me, I need a break, but I don't like the day centre model. That's not for us. So I said, right, okay, so what can we do? So what I developed was small groups of no more than 10 people with 3 members of staff, and it's based on identity, belonging and well-being. Dementia is a cognitive problem, but it's an emotional experience. So if we think of, if everyone puts their hand in the air, okay, this is going to be the brain. So if you put your thumb across, that's your limbic system. Okay, this is your fight, flight, fear. I've taken this from Dan Siegel, who's a professor of clinical psychiatry. If you put your fingers along the top, that's your prefrontal cortex. So this is your brain. Okay, what happens with dementia is that this flips. Okay. So this is your logic. The prefrontal cortex is your executive functioning, your logic, your reasoning, your thinking part of the brain. If that's flipping, what you're exposing are your limbic system, your fight flight. So this is where we will see it being a highly emotional experience, because that's what we're dealing with a lot of the time. The person is dealing with heightened emotions that they can't regulate as well as they used to because of this flipping, and some people's will be flipped all of the time. So we need to expect that if we are going to support people who are living with dementia as best we can to get the best out of their lives. Equally, care partners will be doing this as well because of the stress that they're under in terms of not understanding what is going on and being hypervigilant. You know, where are the problems? What can I do? How can I support? So this is why we need the wellbeing sessions, because we can give care partners a break each week so that they can do some of the things that they need to do in order to continue to support the person with dementia for as long as they possibly can in the best way that they can. So the wellbeing sessions, they're protected time for the carer, psychological preparedness for what's going to come, because it's also a gentle separation. Because if you have people that have been together for a long time or have been retired, if we're looking at people of an older age, there are people of a younger age as well, but if we're looking at people of an older age, they may have retired and spent every day together. So then to separate that person when they're not feeling safe because they're flipping, that's going to be problematic. So if we can start a gentle separation, other people are starting to become part of your life. Care partners are getting used to other people coming in, getting used to the person being okay with other people, and the person with dementia is starting to get used to other people. So that's the wellbeing sessions. We then provide an emotional wellbeing profile, which looks at who is the person, what works for them and what doesn't work for them in a setting that isn't home and their family or partner isn't there. Because that's what we need to understand if somebody needs professional care at some point. It's no good waiting until they're in professional care and then saying, okay, so how does this work? Well, we know their occupation. We've got a This Is Me file, but we don't know how they react and respond in a situation that is different to their home. So this captures what works and what doesn't. And then if a person needs to move into a care home at some point, the staff have the emotional wellbeing profile. So when it comes to moving in, they know how that person can be in that environment when their family aren't there. All of this is about reducing avoidable distress. None of us want this to happen. You know, none of us want these to be here. But we have to be realistic, and this is potentially what could happen. So how do we make it as good as it can be? So why is the Dementia Care Hub and Care Home collaboration important? Because what I've seen is that people feel empowered by the service that we give them until the point of moving into a care home when everything gets taken over. That shouldn't happen. We need to reduce the avoidable distress. Because if it doesn't need to happen, why are we still continuing in this way? Emotional wellbeing profiles understand how the person is and a smoother transition, not just for the person living with dementia, but also for the families. Because families, a woman said to me 2 weeks ago, she said, Kellyn, my husband no longer lays down memories, but I'm laying down memories and they're not memories that I like. You know, so if we can reduce care partners' avoidable distress too, we're doing a good job. So what this does is it joins the dots. We don't have a care pathway in the UK. You know, the dementia challenge that David Cameron laid down, that's gone, and nobody has really done anything about it. So we need to reduce stigma and fear of care homes, because if 80% of the people living in care homes have a dementia of some kind, we can't ignore the fact that even if you don't want to be in there, you may end up in there, and as a family that you may have to make that decision. So I think we need to kind of, you know, realise that and be as okay with that as we can be. I'd like to see people move into care homes rather than be put into a care home. Promote community initiatives. So care homes is aligned with the CQC that they should be community-led. Build trust, relationships and familiarity, because you are going to be at your most vulnerable point at that time. So to already have that trust and familiarity will make it much easier. Support families from diagnosis to death, reduce avoidable distress, and the emotional wellbeing profiles will help with that. So the benefits for families are early engagement. What tends to happen is families engage way too late. They engage when everything is starting to go wrong, when they're on their knees. So get early engagement. Community-based support. So rather than care homes looking like these sale-driven people that want all of your money, all of your savings, and they want your kids' inheritance, it's looking at, okay, let's start engaging with them and see what they can do for us before we even know that we need them. Respite and planning opportunities. So it may well be that care partners want to go away for a week or so. Very difficult to get respite. Equally very difficult for the person to move into somewhere for a week to then move back out again. But if they're already familiar with going to this space because the wellbeing sessions are there, it's a space that they already are familiar with. They know it feels okay. And again, when we think about the emotional side, it's that feeling of being okay. I feel safe. Continuity of care. So if somebody is already attending these spaces, we know of them. We know lots about them. They're not coming in cold, in a sense. So for care homes, they get a USP, so dementia specialists. I get really sick of care homes saying they are dementia specialists. And when you say, okay, so how are you a dementia specialist? Well, we work with people living with dementia. That doesn't make you a dementia specialist. What extra training do you do? We don't. I've got a care home next door to me who say they're dementia specialists. I phoned the CQC and safeguarding about them 3 times. When safeguarding went out, they found that not one member of staff had any dementia training, but they were still calling themselves dementia specialists. That needs to change. CQC alignment in terms of community engagement, occupancy stability. So it means that we know that people are going to be coming in maybe within a 6-month period. We can plan for that. Catching those that don't have a formal diagnosis. Not everybody will have a diagnosis. Not everybody wants a diagnosis. So it doesn't mean they don't have the dementia, but it does mean that we need to be able to capture those too. Improve confidence in staff, because staff already have these emotional wellbeing profiles. They know how the person may well respond. And also stronger relationships with communities. When it comes to care, generally care will need to be paid for. So in terms of care homes, the reason why I never actually thought that this would be something that I would place in a care home is because care homes tend to go, okay, so what's the bottom line? Where's the money? You know, because they're a business, they need to be able to run. But actually what this shows is by the wellbeing sessions being in the care homes, they can actually make a profit by offering this community-based service. So why wouldn't they? They've already got the spaces, they've already got the staff. All they need is the model to go in there. And by people paying for wellbeing sessions, whether that is through their local authority funding or whether that is through private funding, they can actually do this. So what's included in this? Well, I make sure the full implementation, the resources, the training is given. Also auditing. What I don't want to happen is, yes, we've got a dementia community hub, but actually today we haven't got enough staff. So therefore that's kind of not going to happen. We need to make sure that they are following the model of the dementia community hub to be able to say that they have one. that there'll be an account manager that supports staff right the way through so that it should not fail. If it fails, it's on us, not on them. And hopefully we can be in a position where the lived experience of people living with dementia and care partners is what it needs to be. Thank you.